All right, I'm going to go ahead and get us started. A lot of greeting, socializing, all good. Glad to see all of you here in person this afternoon. Good. So I just want to welcome you on behalf of Georgia State University School of Public Health. I'm really proud to welcome all of you to the 2023 John R. Lutzker Lecture Series. This lecture series is funded by an anonymous donor. This lecture was founded in 2018 in honor of Distinguished Professor Emeritus Dr. John R. Lutzker, the former and founding director of the Mark Chaffin Center for Healthy Development, which is here in the School of Public Health. Really pleased to have John and his wife Sandra here today. Real treat to see both of you. It's great to have you with us as we celebrate through this lecture today with our featured speaker shortly, which John will introduce. As we celebrate the school's 10th year, this is our 10-year anniversary, I'm really delighted to see so many of you joining this event in person. In addition to our in-person guests, we have additional guests joining us virtually for a combined total of over 170 participants today. At this time, I really want to welcome Kathleen Baguette, and Dr. Baguette serves as the director of the Mark Chaffin Center for Healthy Development. She's going to share the history of the lecture series and more about John's longstanding legacy with the school. So please welcome Kathleen to the stage.
Thank you, Dean Lynn, and good afternoon. It is an absolute honor and delight to have Dr. Lutzker, John, with us today and his lovely wife, Sandra. John dedicated his academic career to advancing scholarship in the service of preventing child neglect and maltreatment. He's internationally recognized for developing safe care, which is implemented throughout the U.S. and internationally. Through his grants and contracts, he elevated MCCHD to a university research center, and we're focused on promoting health and well-being across the lifespan and addressing vexing social concerns such as child maltreatment, reducing sexual violence and other forms of violence, optimizing social emotional development and well-being, and promoting inclusion and quality of life for individuals with developmental disabilities and their families. So based on John's strong foundational work, we currently have 6 centers in the MCCHD, and we're engaged in research and outreach that fosters social ecologies of health in multiple community-based settings, so in homes, hospitals, schools, child welfare, and in early care and learning settings. And at this time, please welcome John, Dr. Lutzker, who will be introducing our speaker.
Thank you, Kathleen. To be back at GSU, I wasn't going to do it. As exciting as my bar mitzvah was. And listening to Kathleen, most of it was way pumped up. And I look around this room. I'm not very talented. But what I do really well is hire. Most of you. In fact, I was involved in hiring Rodney. So whatever was said, it's all about you. So I have, it looks big. It's 18-point font, so don't worry. And if I can get through it. Dr. Shahla Alai-Rosales received her BA in Childhood and Family Studies from Southern Illinois University, her MA in Human Development from the University of Kansas, and her PhD in Developmental and Child Psychology from the University of Kansas. She's a professor in the Department of Behavior Analysis at the University of North Texas. While at Kansas, she received a National Institutes of Health Service Award. She has taught a variety of courses in Texas, Europe, and the Middle East on a variety of topics, including ethics, early autism intervention, parent training, behavior change techniques, and cultural diversity. She has served on several boards and disciplinary committees and published and presented on research on social justice, ethics and early intervention, play and social skills, family harmony, and supervision and mentoring. Shahla has more than 4 decades of experience working with families and has trained hundreds of behavior analysts. At UNT, among other teaching awards, she received the Student Government Fessor Graham Award for her work with families, an Onassis Scholar Award for her work in the community, the UNT Community Engagement Award, and the Texas Association for Behavior Analysis Center Career Contributions Award. She's an associate editor for Behavior Analysis and Practice, and is co-author of a book, Building and Sustaining Meaningful and Effective Relationships as a Supervisor and Mentor, with Peggy Henkel-Wolf. And with Peggy Henkel-Wolf, a book, Responsible and Responsive Parenting and Autism. I'm crying, so my nose is running, so just... Responsive Parenting and Autism Between Now and Dreams, a book I cannot recommend highly enough for parents and professionals in autism. In her career, she's received 21 grants. Upcoming, Shahla will give a Donald M. Bear invited address to the practice board of the Association for Behavior Analysis International. My wife, Sandra, and I know Shahla very well. She is a Renaissance scholar. Besides her exemplary professional work, she is a voracious reader of novels, poetry, and spiritual works. In 2021, with co-authors Malika Pritchard, who once did a summer internship in the National Safe Care Training and Research Center at GSU, and fellow co-authors Alicia Ray Cruz and Tracy Sion, she published an article called Social Justice is the Spirit and Aim of an Applied Science in Human Behavior, moving from colonial participatory research colonial to participatory research practices. For me, that article is the most influential and paradigm-shifting reading I have done in nearly 20 years. The first of these lectures was on a Monday in October 2018. The preceding Friday, Fred Grant, the administrative dean of the School of Public Health at that time, had asked me to give a talk on my career path. I tried to demonstrate how in our careers and lives, those paths occur through planned and unplanned events. Here's a little combination of those paths about Shahla. She came into our lives in the 80s when Sandra, my wife, was the director of the Southern Illinois University's Infant and Child Care and Preschool, and she became Sandra's student worker. And then she became, soon she became our babysitter for when we traveled without our kids. They loved her, but complained that she burned the pancakes. In her senior year, Shahla told Sandra that she wasn't sure what direction she wanted to go with her bachelor's in child and family studies, so Sandra suggested to her that she see if she could be admitted to my graduate class in parent and child behavior. Of course, I approved. And then she set this path toward her MA and PhD in the Department of Human Development at the University of Kansas, my doctoral alma mater. Today, one of the biggest honors of my career is to introduce to you Dr. Shahla Alai-Rosales. Sanderson, my dear friend and colleague, and a truly distinguished scholar.
I don't usually cry at the beginning of talks. But thank you. Thank you for having me. Thank you for honoring me with being able to speak a few words to you all. The talk is a little unusual. Kathleen and I talked about that, and it's a scholarly talk in some ways. It's also a heart talk in other ways. So I hope you'll bear with me, and I hope it will bring you some insight or at least stimulate some discussion. I am going to start before I was born. My father, this gentleman right here, he was from Iran. He did his internship at the CDC in 1957. It was a very long time ago. And he came here to Atlanta and to Gainesville. If you know what the world was like in 1957, it was a very different world, thank goodness, that it's changed. But there were two things that happened during that period that affected the course of my life. One is he was a Baha'i, so he already had very strong feelings about social justice and racial relations. And he also really loved public health. His degree was from the University of Michigan, from the School of Public Health, which at that time was newly founded. He was one of the more recent graduates. And he really did, his passion for public health was profound and deep. So my dinner time conversations were about public health and prevention and racial justice. So a lot of what we did, like my dear mentors, my parents were activists and they were very involved in the community. So I think that's important to see when I get to some of my later points. The other thing that is important is that when I was a babysitter, and I was a student worker, but I was Sandra's secretary. I worked my way through school. I'm very proud of that. And so two things happened during my period, especially these 2 years at SIU. First of all, Sandra and I literally were sort of in this closet that they gave her when she took over as the director of the University Child Care Center, and I was her student worker. But really what I was this sponge. She narrated everything as she was working and taking a good program, but making it incredible. The narration I heard was about responsivity. It was about the whole child, and it was about the importance of families, and it was actually about joy. And I'm going to circle back to that. Also, when I was babysitting, John had just published this book, which was sitting on their piano. So after the boys would go to sleep, I would read the book. And there are two things about that book that were really important that influenced the course of, I think, my work, and I hope the work of all the students I have mentored. But first of all, it was, for those of you who are in behavior analysis, there's something called multiple exemplar training. It was this beautiful multiple exemplar training across so many areas of possibility for human enhancement, improvement, wonderment. It was a book of hope. And that was critical to me in terms of early in my career seeing that the science of behavior change could be so much. And I have gone on, to teach many children to talk, to teach many students, to teach many children to talk, to socialize, to become parts of their communities. All of that across so many different areas has been because I never felt limited in what the scope of the science of behavior could do. The other thing that was really important, and I don't know if I've ever told you this because I'm also a really nosy person and very curious, so I probably was embarrassed, but there was an inscription in the book, and I will cry again, from John to Sandra. And I won't tell you what it was because they can tell you if they would like to, but it spoke to a very deep love, and a very deep love about family. that also stayed with me. I'm bringing up things that we don't normally talk about in professional circles, and in fact, much of my talk is going to be that. But I feel that, especially at this point in the world with everything that's going on, I think things like love and joy should be part of the vocabulary as well as science. And that is part of the point that I would like to make today. So why specifically a talk about joy? I will tell you part of it is because there is a lot of despair. And I'm going to talk specifically about some of the despair in applied behavior analysis, which is my discipline. And I realize I'm speaking to people from many different disciplines, and I hope that you'll bear with me because like every discipline, we have our Achilles heels and our difficulties, and some of the ones in ABA right now are quite difficult. So I'm going to try to share a little bit of that with you and help you understand why we've been kind of consumed about thinking about joy. So with that, I don't know if you all know who this is, but this is Dr. Ivar Lovaas, probably one of the most inflammatory figures in the field of autism, both famous and infamous. And the sentiment toward him is he's been really helpful and really harmful, and both are true. It is definitely an and I'm going to unpack that a little bit for you. So we have decades and decades, probably over 40 decades of research in autism intervention. And some of that research has told us that very profound changes can be made, especially if intervention is very early. And it's not just the original Lovaas study. There have been replications. But it is a complicated body of research because autism is considered a pervasive disability. The intervention is pervasive also. And it goes across the three areas of human endeavor: communication, social behavior, and what we do, our activities and interests. So if you think about that, everyone's going to have input and should have input into what that process looks like. So when we look at the research, we think some things, that great outcomes are very, very possible with comprehensive, responsive, skilled, caring, and humane interventions. What we have also seen is when there is unskilled, unsupervised, or unresponsive interventions, the outcomes are fairly atrocious. In fact, there is growing concern and controversy. I just snapped one website by someone who's quite reputable who's talking about it, but social media is full of discussions about ABA and the harm that ABA brings, the help that ABA brings. And you may think, oh, it's a small discipline. It is not. It is one of the fastest growing arenas in the healthcare industry, which also makes the conversations more difficult and the tensions. So specifically, and this is from the vantage point of someone who's primarily been a practitioner and had some leadership in practice and a teacher, a professor. But what I have seen and what is reflected in most of the literature is that very poor outcomes and harm occur when services are led by unskilled people. I think that that's something we know in most areas, but it has become very profoundly apparent in ABA services. The other thing is that most, if you look at the graphs of entry into the field of behavior analysis, most board-certified behavior analysts are at entry level right now. The graph goes like this. The slope up is so fast, which means that you have a lot of people who are novices in the field right now. The other thing is that there's a lot of implementation with staff who have limited training and preparation because of that novice entry and workforce. There are more and more studies, which I think my public health colleagues will know better than anyone else, but the disparities in access to services, and not only the disparities, but there's also when access occurs, it is at lower numbers and with a different configuration. And there's another and. And not only that, when it does occur, it is often culturally incongruous with the families that are being served, that the families don't like what is happening with their children. The other thing, and it's a big thing, is there are explicit concerns from the autistic community. People are very concerned about what is happening and in all kinds of different ways. And finally, there's just a lot of despair, which, if you look it up in the dictionary, is the opposite of joy. So what I'm going to do is talk about joy right now. I'm going to talk about some concepts. I'm going to do just a little short concept analysis because joy, at least it's much bigger than I thought it was when I started reading and doing research about it. I'm going to talk about some of the ways to move away from despair and towards joy, talk about specifically families and joy, and how joy finding can be something not only that is good for all of us, but I think is critical for all of us at this point in human evolution. So, when we speak about joy, we think about the dictionary definition, which has something to do with the state of happiness or felicity, a source or a cause of delight. It's a lovely place to start. The dictionary is always good. I also started to look at different scholars, and there are a lot of very wise people who've talked about joy. And one of the things that there seems to be a lot of agreement about is joy is something sacred. And it's sacred in so many different ways, and I won't read you all the quotes, but it is something that somehow lifts our spirits. It makes us feel differently about everything that we're doing, and it helps us see things more clearly, with more insight, and with more care. The other thing is joy is talked about as an act of liberation. And I think this is another very critical one, that Nicholas O'Rourke is a pastor who's an activist, and he talks about when there's so much hate and resistance to truth and justice, joy itself is an act of resistance. So engaging in the processes and the approaches to be joyful is a way of us combating the horror of the world. The other thing is joy is intertwined with hope. That when you carry joy in your heart, you can heal in any moment. So this special emotion has some property to it that changes us as human beings. And I think about during the pandemic, both my daughter and her husband had to work outside of the home. And so my granddaughter came and spent the pandemic with me because I could be at home and help her with her learning. And this was in a worldwide pandemic, and we were losing people we loved during this time. But she would turn to me, she calls me Nene, she would say, Nene, this is the best day of my life. And I would think, you know what? It is. Because what that little darling did was bring joy, and we made a joyful environment around her despite everything that was happening. So joy is very much part of hope. The one that I'm going to focus on the most, though, today, because it has to do with my thinking about interventions, and not that I don't focus on all of those, but people also talk about joy as being something empathic and communal. So it's not an emotion necessarily that we feel just ourselves. It's an emotion that is shared. I think Mark Twain said it beautifully. But there is also this discussion. For example, if you look at the work that has been done around, I think, the Dalai Lama talking about joy, that joy is something that we have with one another. And I'm bringing that up because I think it's also an important part of intervention as well as all of our interactions with each other. There's this YouTube video, and excuse me for showing you a little YouTube video. It's very short. For those of you who watch YouTube videos over and over, this is one I've watched a lot. It's like just getting a little joy buzz. But it also has made me think, and there's a longer version of it, and there are several of these. In fact, if most of you have had young children and parents who have learned to be very connected, you'll see the same kind of patterns. But I'm going to just show a little bit of it. Let's see if it goes. And I just want you to watch what's happening in the interaction. I'm going to talk about it in the context of autism.
That's what I was wondering. I don't know what they're going to do next season because they did some stuff this time. Exactly what I was thinking. Oh, yeah. Right. Don't bring that in. You know what I'm saying? Don't do the same stuff. You know what I'm saying? Yeah, I like that. Yeah. Like, go somewhere else with that, but don't bring it here. You know what I'm saying? Yeah.
Honestly, you could just keep watching this. But as a person who works in autism intervention, everything that goes there isn't usually what's on the data sheet. I know it is for you all, Kathleen, because I was telling Kathleen at lunch, I'm in this in-between world between my early childhood super foundation and the world of behavior analysis where that's not on the data sheet. But what I want to say is probably the most profound things, and what I think the research that you have all been doing in other arenas tells us, is that it is those connections, and not just the connections and the responsiveness, but that empathic emotion of joy. You look at both of them, joy is the word I would use for what they are exuding with one another. And there's like a bonus to this. It's not just with one another. The mom is behind the camera, and she's part of the Joy Fest, which is also something for us to pay attention to, I think. So, part of what we have been working on and thinking about and teaching about is that empathic emotions are joy guides. Those emotions that we share with one another are guides to more joyful existence. And again, for most of you, this may seem like, oh yeah, but for some of my colleagues, are not quite accepting of emotions. So first of all, it is important to understand that we communicate through emotions, that so much of how we express in the world is through emotions, and that for the behavior analysts, emotions flag specific contingencies. They tell us about what's going on, where there is a fear, where there is joy, where there is anger. All of those things tell us about what's happening in that person's environment. So I'm going to do a little step back for those of you who aren't behavior analysts, or if you are a behavior analyst, to tell you how I'm looking at it. But basically, when we talk about a contingency in behavior analysis, we're talking about it as a lens for understanding relationships between what people do and what's happening in the environment. And we're very concerned with timing. What happens before, what happens during, what happens after. That gives us working units to be able to shape development and behavior in ways that are favorable for the humans that we're working with. And that what applied behavior analysts presumably do is to shape and improve relationships that are valued. I'm going to talk about that next. So here are some of the basic assumptions of ABA. First of all, that it's a science. Science is progressive. It means it will continually change, which I think is one of the struggles the field is having right now, is how to be changeable. The other thing is all sciences attempt to understand order. Applied behavior analysts attempt to understand and influence order that is valued. And value is a very difficult thing. Social validity of what we're doing is something that is assessed not only from the point of view of the child we're working with, but also their family, their community, our research community, and society at large. It is a constant negotiation about what is important. So in applied behavior analysis, we have learned a lot about problems. We have spent over 60 years, and a beautiful 60 years, figuring out about the different functions and treatments for behavior people call problem behavior. We've learned a lot about the contingencies, and there are 4 areas that generally people have difficulty in: when they can't communicate, when they can't connect with other people, when they don't have activities or have limited reinforcing activities, and when they have difficulty negotiating potentially aversive conditions. These 60 years of research showing this. So this is where my dad came in. We wrote a paper, and we have been approaching, which again, to my early childhood colleagues, may not seem as revolutionary as it does to some of my other colleagues, but what we proposed is that let's move away from difficulty early on and towards joy. In fact, we said let's do the big 4. There are 4 things every child should start learning, and these are them, from the onset. And that not only should they learn to communicate, to socialize, to adapt, but it should be more than just having them stop being a problem. That however we design the interventions, that not only should they reduce the problem behavior, but they should access reinforcers, and others should access reinforcers and enjoy being together for the sake of being together. And I'm going to loop around back to that in a minute. I do have to tell you, when we published this paper, the reviewers wanted us to take out all of the joy talk and all of the emotion talk, and because it didn't sound scientific. And I will tell you too, they came back, and I first, do what I usually do, is get a little pouty, and then I put on my big girl pants and think, okay, what didn't I explain? And we went back, and I think we explained it better. And that is where we started learning to talk a little bit better about we have to go beyond satisfying the functional equivalence of the problem behavior. Life is much more than that. And that when we speak of something like joyful, I've underlined it here, but hopefully we're describing something beyond relief, and that we are doing something in our interventions that increases the enjoyment, the beauty, the pleasure, the wonderment of interactions with one another. And I want to say, too, us saying these things was nothing new. And I'm going to give a nod to my dear mentor and great teacher. The very first study by his mentors used the joy word in the very beginning. People were not afraid to say in discussion sessions, we made people happier. We did something that improved quality of life. And they were not afraid to start trying to measure those things. In fact, Mont Wolf, in a paper in '78, talked extensively about that. Like, we need to be figuring that out. Dr. Lutzker, in one of the first studies looking with families, with one mother, but what that mother talked about and what they talked about in the discussion is that she was happier, that she found her child more desirable, that they liked spending time together. And the Kegels, who they're a group in autism intervention, but have, I think from the beginning, been talking about everybody's feelings and having those feelings improve and get better. So there is a foundation for this. It's just in the rapid growth and the acceleration of other areas, I think we have forgotten part of it. So what I want to talk about next is give you just a little bit of an example. And you know what? I don't have the cues about time, so I don't know. If maybe you just give me a 10-minute up. Anyway, we have over 50 years of progress working with, 10 minutes? Okay. You know what? I am not going to show the other video, and I will go through the last part quickly, but I'm just going to tell you a little story, and I'll leave you with that, about our own project that we work with families of children with autism. And so in addition to the 60 years of progress with the functional analysis, there's also 50 years of progress or more working with families successfully. And we've learned all these really important things that I think you all are well aware of. Everything from the power of attention to the problems with coercion and punishment, how important early is, and also how the family matters. In fact, one of the things I would say that I think this is like me preaching to the choir, is that if we're joy finding, one of the places to start joy finding is with families. In fact, I love in the UN Declaration of the Rights of the Child, they talk about the family as the fundamental unit. And they talk about the right to happiness and to grow up in safety for every child. So if we start with families, I also refer to one of my mentors, Dr. Todd Risley and Dr. Betty Hart, that this idea of joyful families, you all may know about their vocabulary studies where they looked at the number of words. Well, they actually did the second level of analysis about the social world of children learning to talk. And they talked about what the interactions were like. And a lot of it had to do with the mutual reinforcement and what they called the dance. So we developed a little program. It's called Sunny Starts, after one of our first kids. And in that program, we use the dance metaphor and the dance acronym. I won't go in all the detail of it, but it's just a little way for the parents to remember and for us to remember how to train. So we started this, and the outcomes were pretty good. This is a published study of the first 8 kids. The parents and the kids had fewer skills. There was less joint attention. We intervened. There's more joint attention. The graphs go up. But we also started counting smiles very early on, because if you look back, part of the dance, we had the joy in there from the beginning. So that was part of what we worked on, that everyone needs to be happy and continue being happy. And then, out of the Kegel lab, came this study, and they had this measure of synchronous engagement, which is a beautiful measure. I fall in love with measures. and this is one that helps you see the joy and also helps you see the responsivity between the parent and the child. And there are different variations on this. I'm not saying this is the only measure, but what I am saying is these measures are important. In fact, what we shifted to is having what we call the triad of care. We have parent measures, we have child behaviors, and we focus on the big 4. And then we also have measures of the joyful relationship, the synchronicity between the parent and child. I won't show this video, or maybe I should. Let me show the video. So this is, it's another little reinforcer. This is a family that we worked with in our little short-term program. This was through a grant that we had serving under-resourced families. And in the program, the mom actually it was the mom, the dad, the grandfather, the cousin, and the brother. Everybody came. It was big training. Anyway, during the training, the time we were with them, the family learned all those parent skills of the dance, and then the child learned facial orientation to look at whoever was there, and then also just 2 little approximations to tickle and I think pizza. So those were very high preferred things. And they were just sounds. Less than a month later, and Mom has given me permission to show this, she sends me this video. So I'll show you a little bit of it. Oops. Ooh. Sorry, go ahead. Okay.
Stand right here. Ready? Okay, you gotta say it louder. Ready? Ready? You gonna say it? Ready, set, go. Ready?
Set, go.
Yeah, he really didn't talk months before that. She really did teach him all that. But if you look, the cadence of the interaction, it's gentle, it's happy, it's joyful. There's no verse of control. Like the way that it's put together is joyful. And I'm not saying it's the best example, but what I am saying is we should be working towards that kind of joy in interventions. again, from my dear advisor. This was probably one of those $1 million metaphors that you learn along your career, but the families are like tide pools, that working within that family, you work with everyone and what's going on with them. And this is from another colleague, Angeliki Gina, who is a Greek scholar, but she talks about the importance of all ecologies. Your ecologies are as important as the mother's, as the child, as your students, and that all of that is part of our learning of this time. I am gonna maybe close your eyes for a second because I'm gonna go ahead to one slide because if I'm gonna leave you with something. So what we talk about are the joy finders, and in our book we talk a lot about each one of these, but I'm gonna leave you with one of the joy finders. Sorry, there's a whole lot of them. I gave the, oops, nope, that's it. I'm gonna leave you with bell hooks. So bell hooks is one of the most important philosophers, feminists, womanists of our times, I believe. And she talks about a love ethic. She talks about this idea that we have to move away from fear and domination-based structures. And that means with me as a teacher to my student, with the parent to the child, with anybody in any of those ecologies, and in our larger ecologies also. She also talks about the fact that we want to center on caring relationships. And again, a little nervous, thank you, Kathleen, to talk about that in a distinguished lecture. But the thing is if we don't have the caring relationships, we will blow our world up at the level of the child and at the level of nations. And the other thing, the last bell hooks mic drop, is that it's a commitment to all of us. Like, no one is indispensable or unimportant in this life. Anyway, I'll stop there.